Leukemia is a type of cancer that affects your blood. It starts in your bone marrow, the spongy tissue inside your bones where blood cells are made. In leukemia, the bone marrow starts making abnormal white blood cells. These abnormal cells, called leukemia cells, don't fight infection like healthy white blood cells do. They also grow and multiply much faster than normal cells, crowding out the healthy cells in your bone marrow. This can lead to serious problems like infections, anemia, and bleeding. Leukemia is a complex disease with many different types and subtypes. Some types of leukemia are more common in children, while others are more common in adults. The exact causes of leukemia are still being studied, but we do know that certain risk factors can increase your chances of developing this disease. The good news is that we've made significant strides in diagnosing and treating leukemia. With early detection and proper treatment, many people with leukemia can go on to live long and healthy lives. Leukemia is broadly categorized into two main types, acute and chronic. Acute leukemia progresses quickly, with symptoms often appearing suddenly. Chronic leukemia, on the other hand, develops slowly, and people may not experience symptoms for years. Within these two main categories, there are several subtypes of leukemia. Acute lymphocytic leukemia, or ALL, is the most common type of leukemia in children, while acute myeloid leukemia, or AML, can occur in both children and adults. Chronic lymphocytic leukemia, or CLL, and chronic myeloid leukemia, or CML, are more common in adults. While the exact causes of leukemia remain unknown, several factors can increase your risk. Exposure to high levels of radiation, such as radiation therapy or nuclear accidents, is a known risk factor. Certain genetic disorders, like Down syndrome, can also increase the likelihood of developing leukemia. Family history plays a role, as having a close relative with leukemia increases your own risk. Leukemia can manifest in a variety of ways, and symptoms often mimic those of other common illnesses. Fatigue is a hallmark symptom, leaving individuals feeling constantly tired and lacking energy. Frequent infections due to the decrease in healthy white blood cells are another red flag. Easy bruising or bleeding, even from minor injuries, can signal a problem with platelet production. Bone pain, particularly in the long bones of the arms and legs, can occur when leukemia cells overcrowd the bone marrow. Diagnosing leukemia typically involves a combination of tests. A complete blood count, or CBC, measures the levels of different blood cells and can reveal abnormalities suggestive of leukemia. If leukemia is suspected, a bone marrow biopsy, where a small sample of bone marrow is extracted and examined under a microscope, is performed to confirm the diagnosis and determine the specific type of leukemia. Imaging tests, such as X-rays, Connecticut scans, or MRI scans, may be used to assess the extent of the disease and look for any involvement in other organs. Treatment for leukemia is highly individualized, depending on the specific type and stage of the disease, as well as the patient's overall health and age. Chemotherapy, a powerful drug therapy that targets and kills rapidly dividing cancer cells, remains a cornerstone of leukemia treatment. Targeted therapy, a newer approach that uses drugs designed to specifically attack leukemia cells while sparing healthy cells, has shown great promise. Radiation therapy, using high-energy X-rays to kill cancer cells, may be used in certain cases. For some patients, a bone marrow transplant, also known as a stem cell transplant, may be an option. This procedure involves replacing the patient's diseased bone marrow with healthy stem cells from a donor. Immunotherapy, which harnesses the body's own immune system to fight cancer, is an area of active research and holds immense potential for the future of leukemia treatment. While leukemia is a serious disease, advancements in treatment have significantly improved outcomes for patients. With early diagnosis, personalized treatment plans, and ongoing support, many individuals with leukemia can achieve remission and live full and meaningful lives.